Hi, my name is Latrice Churchillo, and I am a caregiver and a mental health advocate. My subject today is protecting our youth and ending the adult incarceration of children with mental health challenges. So, imagine being a 14-year-old struggling with anxiety, PTSD, or even worse, a psychosis type disease. And instead of receiving help, you're placed in an adult prison. This is not a distant reality. This happens every single day across America. According to the Sentencing Project, on any given day, nearly 3,000 children are held in adult jails and prisons across America. This is far too many children, especially Black and brown youth. They're treated as adults when their real need is mental health care and some compassion. The change we need is very simple. Our justice system must stop charging and incarcerating children with mental health issues as adults and instead provide care and rehabilitation that they deserve and need. The United States has received international criticism for its past use of death penalty for juvenile offenders up until 2005 and for currently sentencing them to life imprisonment without the possibility of parole. The United States is the only country in the world where kids as young as 13 years old have been sentenced to life in prison. This practice is considered a violation of their fundamental rights to special protection by the United Nations Convention on Rights of the Child. So the problem is, children facing mental health challenges are often seen not as kids in crisis, but as criminals. When these youth, especially children of color, are treated as adults, the outcomes are devastating. The Center for Disease Control and Prevention study in 2021 found that the youth held in adult facilities were 5 times more likely to die by suicide than those in juvenile centers. Black and brown children in particular are unfairly targeted by a justice system that portrays them as older or even more dangerous. Research from Georgetown's Law Center on Poverty and Inequality highlights that Black and brown children are adultified and viewed less as innocent and more responsible for their actions, resulting in harsher sentences and even fewer opportunities for help. This is not justice. This is a systematic failure with lifelong consequences for these kids. Why does this continue to happen? That's because many state laws still allow, including Arizona, and require that certain youth be tried as adults, as young as 15. They overlook the mental health and developmental needs. The American Psychological Association stated that the adolescent brains are not yet mature, and especially in areas of impulse judgment, and which makes them more vulnerable. This is bias that leads society to perceive Black and brown children as older and more culpable, resulting in harsher sentences for them. And finally, a severe lack of funding in politics prevents the expansion for diversion of programs that would keep these children out of incarceration and in care. Over 50% of American schools have armed and sworn law enforcement officers or school resource officers, but don't have a full-time nurse or counselor in the schools. So the solution is that this cycle can be broken, but it requires commitment and reform. The laws should prohibit charging or imprisoning any child with a mental health diagnosis as an adult. The National Alliance on Mental Illness reports that nearly 70% of the youth involved with justice systems have a diagnosable mental health condition. However, they rarely receive the help that they need. So every child entering the system should receive a mental health screening and access to trauma-informed care. Our communities have to invest in the school-based counselors, local clinics, and culturally competent treatment programs. Law enforcement, judges, prosecutors, they all need mandatory training on mental health and bias to ensure fair, informed decisions that prioritize the care of these kids over punishment. So when we treat kids as disposable, we all lose. Every child deserves compassion, healing, and a chance to grow beyond their pain. This means each of us can help. It's not enough to be aware. Change requires action, and everyone listening to the sound of my voice can play a part. First, advocate for legislation that bans the practice of charging kids with mental illness as adults. Contact your local representatives and tell them this matters. Second, support organizations that provide mental health services and legal advocacy for these youth, especially those serving Black and brown populations. Donations, volunteering, and even sharing their work helps amplify their reach. And third, push for more funding in your local community for schools, psychologists, youth programs, and trauma-informed education. These services will help keep our kids from ever entering the justice system in the first place. And finally, conversations. Talk to your family, your kids, your church, your neighbors. Many people don't even realize how unfair the system treats children. And awareness leads to empathy, and empathy will fuel the reform. We all share responsibility to protect our children. They're not their diagnosis, their mistakes, or their behavior. They're developing humans who deserve care and a chance at life. Justice should mean healing, not harm. So, in conclusion, these outdated laws and the bias cause mentally ill children to face adult punishment, while the lack of mental health care keeps them trapped. Evidence-based solutions like legislative reform, early screening, community investment offer the path to real change. Justice should mean healing, not harm again. And together we have the responsibility and power to protect these kids. Thank you for listening.